Thank you for taking the time to complete vision awareness training today. The following video will provide you with practical tips on how to support a person who is blind or has low vision. You will have the opportunity to download a Vision Tips resource at the conclusion of the training.
Woman with injured arm walks into hospital emergency room.
People who are blind or have low vision may use aids to assist them. If the person presents with a guide dog, do not interact with the guide dog. They are working.
How can I help you?
My name's Catherine and I'm in a lot of pain at the moment. I'm here with my guide dog and I need some help.
If the person presents with a carer or a support worker, ensure you speak to the person who is blind or has low vision, rather than the carer or support person.
Thanks for that. So I'll get you just to have a seat in the waiting area. If you turn behind you, there's some vacant seats directly behind you, and then a nurse will come and take you to the ward.
We should not assume a person will need our assistance. Instead, use the approach, ask and assist strategy.
Nurse walks into waiting room and approaches patient.
Hi Elizabeth, my name's Matt. I'm one of the nurses looking after you today. We'll just take you through to the assessment room. How can I assist you?
Thanks, Matt. If I could take your arm, please.
Absolutely.
Thank you.
All right, we'll just head off down here and we're just going to take a right turn and we've got about a 15-metre walk down to the assessment room.
The key to being a good guide is good communication. Some other tips for guiding include: leave enough room for the two of you, look for hazards in front of you, and let the person know if you need to make a sudden change of speed or direction. When supporting a person who is blind or has low vision, it's important to describe any procedures. Ensure you ask permission before touching them, and it's important to ask if the person has any questions.
Nurse and patient in hospital room.
We've got you seated in the observation room, so we're just about to do a couple of checks.
So what's that involve?
We're going to do a blood pressure check, so we're going to put a cuff around your arm to check that, and also a clamp on the finger just to do the heart rate. So I'm just going to go leave the room to get the machine and I'll come right back.
A person who is blind or has low vision may require orientation to understand the layout of a space so they can move around independently.
Nurse and patient with guide dog walk into hospital room.
So we're just heading towards the bed.
Okay.
And the toilet here on the right. And I'm heading towards the mattress, putting my hand down there for you.
Lovely.
The pillow's on your right at the moment.
Oh, that's okay. Thank you.
That's okay. We have
This
a
way,
nice little
Ness.
window behind us as well.
Okay.
Nurse walks into hospital room and approaches seated patient.
And come time to get ready to get you into your gown.
Okay.
So I've got that in the bathroom. Can I help you with that at all?
Yes, could you orientate me in the bathroom, please? And but I'll be right with the gown.
Absolutely. Come through. I'm just opening the door to the bathroom now, out to my right. Just step around here into the doorway. On our left here is a grab rail on the wall. Ahead of us is a sink.
Yes.
In your 1 o'clock is the shower. And in the far right corner here is the toilet.
Thank you very much.
That's all right. And on the back of the door is the gown for you.
Okay, thank you.
Great.
The clock face method provides directions or locations of items for a person who is blind or has low vision. When using the clock face method, you give directions from the point of view of the person facing 12 o'clock.
Nurse and patient bedside with plated food on table.
I'll just bring the tray around closer to you. Just a quick rundown. On the tray, at 3 o'clock we have some juice in a cup.
Okay.
And then directly in front of you is a plate. And on that plate you have a wrap at 3 o'clock, a piece of watermelon at 9 o'clock, and 2 grapes and 2 bits of mandarin at 12 o'clock.
Thank you very much. That'll go down very well.
Every person has different needs and different ways of accessing tools in the hospital. This is something that all health staff need to consider and make reasonable adjustments for.
Nurse talks to patients sitting up in bed. Guide dog lays bedside.
Well, I've got a table here I've just got right in front of you, and I'm going to put the water there for you. Bottle
Okay.
of water. There we are, that's straight in directly in front of you.
Thank you very much.
I'm also going to grab the call button here. I'm passing it through the handle of the bed. Where would you like me to place that on the bed?
Can you put that in my hand,
Certainly
please?
can. There we go, there we are.
Thank you. Now, where's the actual call button?
Just following my finger, where my finger rests is the actual main call button.
Okay then. Right, so that's it there.
That's the one.
That
Assistance.
top one.
Yeah, that's
Okay.
the one.
Doctor approaches seated patient in hospital room.
When discharging a person who is blind or has low vision, explain any care and medication to them and ensure they understand. There are some extra things you'll need to do, such as offering to input important phone numbers into the person's phone, rather than giving them the numbers on discharge documents. And describing the shape of medications can assist the person to differentiate between different types they are being given, especially if the medications are new.
Now, as we discussed, I've ordered you a couple of new medications. I want you to pick them up from the pharmacy. One of them will be a small round tablet, that's for your blood pressure. I want you to take that at the same time every day.
Thank you for taking the time to complete vision awareness training today. Don't forget to download the Vision Support Tips resource. We hope the information and tips in this video have been helpful.